Hi, Pat Rooney again. As I stated in my first episode, this being the second, I spent 25 years on Wall Street. I'm a Canadian, and I've branded my podcast or my broadcast here is Catch the Golden Ring. And in my first episode, I described a parallel to my Alzheimer's experience, that being the discovery of what you know today as LASIK. In the beginning it was PRK, and then LASIK came. I told that story and how we introduced it starting in Italy. And in the whole process of building a business, the main item is get started. But when you get started, then don't get ahead of yourself, because you're going to learn so much from your original concept until you're ready to roll it out. In Italy, the reason I moved to Italy, first of all, there are more ophthalmologists in Italy than any per capita than anywhere in the world. Second of all, I was 5 or 6 years before FDA approval, and an ophthalmologist in Italy got the first excimer laser. And I then described after that how the other thing I learned is to walk medical conference floors and get exposure to what's happening in whatever area of medicine, if we're dealing with healthcare, which happens to be a big market, and we will have been in every industry, so we can switch to other industries in the future. However, there he is. We start in Italy. The first item is patient acquisition. We had 2 centers that we built, one in very quickly, one in Milano and one in Rome. And we were advertising, and we were going to ophthalmologists and educating them on the process and getting them to send patients into our clinics, where we obviously trained and hired ophthalmologists only. But one day a guy comes to me who became a very dear friend of mine. He unfortunately has passed at this point, by the name of Simone Bencaglia from Florence. Simone was in the lithotripsy business, which means he had this very big machine on the back of a truck, a tractor trailer type truck. And what he would do is go from market to market and explode kidney stones. He came to me and he said, "Listen, Pat, I have an idea. How about if I take your excimer laser, we put it on a truck, we make deals with ophthalmologists all over Italy. We take and my crew takes it to an ophthalmologist's office. We roll it into his office at 8 in the morning. We come back and roll it out at 6 o'clock. And now the ophthalmologist looks like he's on the leading edge of technology. We'll teach him how to do the procedure, and there it is." That's exactly what we did. We invented roll on, roll off. And in a very short period of time, we had 60 ophthalmologists across Italy, including in Palermo in Sicily, that were doing PRK and then LASIK, which is something else that we brought through Dr. Tafor in Windsor. We introduced LASIK to North America. But it's about patient acquisition. So here we are, we're in the Alzheimer's business. Interesting about Alzheimer's, it's very much like when I was a kid. And by the way, I haven't said this, but I'm 86 years old. So why I care about this is I care about this more than anything else, obviously. I'm into longevity, quality of life. how do you live longer, etc., etc. My dad died when he was 64 of a heart attack in the church parking lot, by the way, which is not a bad place to go. But anyway, so there it is. How do we now impact it? Nobody wants to talk about Alzheimer's at this point because they didn't think there was a fix. Well, there are now 2 monoclonal antibodies, drugs, that are approved by both the FDA and Health Canada. Unfortunately, in Canada, we have socialized medicine, and with socialized medicine, the provincial health authorities at this point have not yet reimbursed either brain-specific PET that that's our new excimer laser. That's the new shiny object. So basically what we want to do is we're going to bring it to Canada, and but then we have to deal with patient acquisition. So that's fine. There are 2 machines that have been delivered from 2 companies, 3 different locations in the US in the brain-specific PET business. It looks like a barber chair with a hair dryer looking contraption on your head. What you do is the doctor comes along, first of all, in a cyclotron, a radiopharmaceutical is produced, and that's, think about sugar, goes to inflammation in the body directly. So in a cyclotron, you attach a radioactive charge onto sugar, insert it into the vein, and it goes to the metabolism and therefore lights up the problem area. That's how PET works. Let's start in Canada. The fact that Health Canada has approved it, but it's not reimbursed, that's a big positive, because that means we can be in private medicine here in Canada and solve the problem before the government starts to solve the problem, because they take a lot longer. So basically what happens then is that's fine. So how do we start to fill the funnel? How do we find the patients? Because PET is a $4,500 procedure. You're not going to say, gee, everybody run out, go to your doctor, get a prescription to do a PET. It's just too expensive. The numbers don't work. So we do research and we find the genetic test. The genetic test, there's something, and 9 months ago, I didn't know this stuff, right? But basically the genetic test, did you know that 25% of people have 1 copy of a gene called APOE4 that gives you a higher propensity towards getting Alzheimer's, 4 times more than somebody else. If you have 2 copies of the gene, it's even more dramatic, 12 times bigger. Somebody you know has 2 genes that's well talked about on the internet, and that's Chris Helmsworth. And what he does is he did the thing that is one of the treatments if you don't want to take the drugs, and that is you change your lifestyle. There are now in the last 2 years have been more than 1 blood biomarker where you can take a blood test to confirm it. However, we discover something that's very dramatic, and that is the retina. The retina is and we know it of course from LASIK, but the retina is the back of the eye, but the front of the brain. The metabolism and the vascular activity and proteins can be seen in the retina using something called a hyperspectral retinal camera. Well, there's none that exists that is FDA approved at this point. However, we discovered there is a HSI, hyperspectral retinal camera, approved for macular degeneration and for diabetic retinopathy, and they now have submitted a research that complete and soon we believe they'll get FDA approval, and then after that Health Canada approval by the name of Optina, and they will then be able to read the biomarkers indicative of Alzheimer's. Now, why is it super topical and exciting? Cameras today that all your medical professionals have, the optometrists and the ophthalmologists, they read 3 bands of light. A hyperspectral camera reads 92 bands of light and gives off 30,000 data points on the retina that measure disease in the body that's manifested on the retina. So we make a deal with Optina. Okay, fine. Now we have the filter into which we can take and we can go to the next step. Well, that's terrific, but that's not quite FDA approved yet, and it's still a $400 test. Okay, maybe there's even maybe there's even an earlier filter. Now we discover something called Remedio out of India, and it's a handheld, very elegant, what's called a fundus camera, that using AI that will only use 3 bands of light, but it will give an early indication of biomarkers that are indicative of mainly diabetic retinopathy. But diabetic retinopathy is 29% of people with type 2 diabetes will go blind if they don't deal with the issue. And so it's very important. But the other thing is 50 to 100% of all people with diabetes have a higher chance of getting Alzheimer's than somebody that doesn't have type 2 diabetes. So now we take and we say, let's make a deal with Remedio so that we can now recruit optometrists, and there are I believe 65,000 optometrists in the US and Canada. And we can also recruit pharmacists. There are 4 million pharmacists in the world, 360,000 optometrists that would be able to be the early stage filling of the funnel. And so now we build it all the way through. So what happens is you'll go into your optometrist, you'll get a quick zap, just a reading, non-invasive, no eye drops, etc., that will be an indication of disease. That will be sent to our super center, which we call a clear clinic for longevity, because the reason I'm in this, I'm in the longevity business also for personal reasons. And then from there, we do the larger HSI, hyperspectral imaging scan. We send that report along with genetic testing and blood testing, a complete workup, to the neurologist. The neurologist does cognitive testing and says, whoa, this person should really have a PET scan so I can see the plaque buildup in the brain. Comes back, we refer them into our PET center, and our PET centers will either be company owned or franchise. That's a whole other story. And that's how we will build the business. And we will build it with franchising, because we learned, and I learned on Wall Street, that, and that will be a topic for another day, that franchising is the way to go, because now you have a dedicated businessman or perhaps a neurologist that will be a franchisee, and we will teach them all about the business of it. And the cash flow is very attractive. So that's our plan as we go forward, and you will hear a lot about it in our next episode. Thanks.